With us today, we have Dr. Roger Gallant, who is the medical director for the NEWSTART program here on the Weimar Institute. And today he's going to be talking to us about exercise. So in this episode, we've been learning about exercise, and I'm hoping maybe you can share with us what are some of the long-term and short-term effects of exercise on our body.
Well, exercise in the short term actually gets your blood circulating better, which is one of the ways to keep your body healthy. We want to make sure that we have good circulation, and when we start using large muscle groups, they require more circulation to help them to function better. Exercise also has an effect of lowering your blood pressure and lowering your blood sugar. And so those effects start pretty quickly as you start to exercise, but they've shown, research shows that for example, blood sugar lowering effect can last for up to 16 hours after you exercise. So that's a pretty long-term effect, and it's one of the best ways to treat diabetes and high blood pressure and heart disease is by increasing your exercise. Also, as you exercise, you start to lose weight, and weight loss for many of us can be very crucial to being healthier. And so I think exercise is a great medicine to treat some of these lifestyle diseases that we see.
I think that's a great way to put it, a great medicine. And I'm wondering too, we've talked about the body, but what about the mind? What are maybe some simple and rapidly occurring benefits that you can see from exercise on the mind, even in the short term and the long term?
So as you start to exercise, like we said, circulation improves. You're going to get better blood flow to your brain. That means you're going to get more oxygen and more glucose. Our brains require oxygen and glucose to function optimally. And so as we start to exercise, we're going to increase blood flow to the brain, which is going to make the brain work better. Also, exercise releases endorphins that are things that help us to feel better, help us to have a more positive outlook, and help us to help our brains to just function better. You know, if you go outside and take a walk in the fresh air, after you come back, you feel rejuvenated, and your mind works more efficiently if you do that as well.
Wow. So for people maybe that don't have the ability to exercise as long or as hard as others, is there still some benefit found in moderate exercise?
Absolutely. In fact, for the majority of our patients, we recommend moderate exercise. And the way we define moderate exercise is if you are able to exercise and keep up a conversation, you are at a moderate pace. When you're winded and out of breath, you've gone beyond moderate to more intense exercise. And so what I tell patients is, you know, if you're able to keep up a conversation, then you're able to exercise at a moderate pace. And that is different for each of us as individuals, because we all have a different level of exercise tolerance. So I tell people, start where you are. If you can only walk for 5 or 10 minutes, do that. But then every day, try to increase that a little bit and do a little bit more. And research has shown that if you do that, you can actually reverse heart disease, you can reverse diabetes, you can reverse high blood pressure, some of these diseases that we consider the lifestyle diseases.
So you recommend to people to kind of start a little slower into it, maybe if it's something that they haven't been doing frequently or maybe haven't done ever, just to kind of slowly ease into exercise and not push it too hard.
Yes, yes. And then as they are getting more accustomed to it, gradually build up.
So what about for someone maybe who's just struggling to find the motivation to get up and maybe exercise early in the morning, or they're wondering where is the right time to exercise? What kind of a motivation or tips can you offer to someone like that?
So I do recommend exercising early in the morning. Early in the morning, the air outside is the cleanest. You know, there's been less traffic and industry through the night, and so the air is clean. I recommend trying to exercise outside if at all possible. Research also shows that people who exercise early in the morning tend to stick to the exercise habit better. You know, when we say, oh, I'll exercise when I get home from work, it usually doesn't happen, because by the time we get home from work, we're tired and it's been a long day. Something that can be motivational for people is if you exercise with somebody else. You are able to each motivate the other to stick with the exercise. Or now with the different types of exercise programs and social media, sometimes just sharing your exercise with others and sort of not necessarily making it into a competition, but trying to see who can get the most steps in a day, or at least share with somebody else so you have some accountability that you're keeping your exercise going. I think that's a great way to motivate people and keep them on track. Some people like to see that they've hit their step goal, 10,000 steps or more. And so having something that tracks your steps like a watch or a phone or a pedometer can be a good motivator for some people as well.
Well, thank you, Dr. Gallant, for taking the time to share with us about exercise, and I hope that we can implement some of these principles to start out wherever we are, just to exercise a bit.